Family, the holiday season is a time for joy for many people, but for others, it may bring anxiety and lead to mental health issues. Nainesh Kotak is here with tips on navigating feelings of depression and isolation during the holidays. How tough is this time of year for some people?
You're absolutely right. You know, for many, it's a merry time, Merry Christmas, but for a lot of people, it's one of the hardest times of the year. You know, they may have issues, family-related issues, economic-related issues, and, you know, may have had tragedies in their life in the past. And there also is seasonal affective disorder. So we have a lack of sunlight, and this affects people too. And, you know, Canadian Mental Health Association is saying that up to 50% of Canadians will experience some sort of mental health related concern around this time of year. And it could be loneliness or sadness. I think it's very important to look out for one another and look out for those signs and realize that there is treatment out there for people. Because the issue is one of the biggest problems, mental illness that goes untreated can lead to an often crisis situation and tragedies, and many of that could be avoided if we take care of ourselves and if we look after each other and learn to recognize the signs of mental illness and as it gets worse this time of year. Our area of practice, we practice long-term disability litigation, and the majority of our clients have some form of mental illness. It may begin because of physical pain that they have, but often it's actual mental illness itself. So we do see that in our practice quite a bit.
Now, obviously, we're getting a little bit better with seeing or understanding mental illness, but like a physical illness is visible. You can't necessarily see a mental illness. How does that affect the workplace?
You're absolutely right. You know, we see now workplace stress that's always been present. Now most people are back at work in their offices or their factories, and that leads to, you know, some interpersonal conflict that they might have had before, issues with management, and we see a lot of workplace stress related claims in terms of disability claims. Yes, you cannot scan it. I mean, they're all what's called subjective complaints, and there still is a stigma in our society attached to mental illness, and it's unfortunate. And employers sometimes they don't really take it seriously, and insurance companies deny claims, and they tend to use this catch-all phrase, there's insufficient medical evidence. In terms of tips or advice I have for people, you know, if you're having stress at work or you've made a disability claim, most important, have contact with your family doctor. That should be the primary person you go to. Every time you go to the doctor, they write down what your complaint is. And from there, you can get referred to a psychiatrist. I know it takes a long time to get those appointments, particularly in rural areas. You're looking over a year or so. But there are counselors that you could be referred to, psychotherapists, social workers, that serve two purposes, really. One, to help the person get better. And number two, most insurance policies, disability insurance policies, have a provision that if you don't seek treatment for your ailment, you will not get paid benefits.
It's got to be pretty frustrating for people already suffering from mental illness to deal with the disability claim process.
Yes, it can be frustrating. You know, I mean, look, for the most part, one would think insurance companies would do a good job, and often they do. But sometimes you run in a situation where the case manager is constantly harassing the insured person, you know, the person who's making the claim. They're calling them, well, why don't you try to work? Why don't you do this? And I see it when I go through claims files and I see those calls, you know, they record them. And the frustration that our clients have or disabled people have when their judgment is being questioned, when their condition is being questioned, it often, in fact, as you say, makes things worse.
All right, there's less than a minute left. What can people do to get your assistance in a situation like this?
Right, so again, we represent clients who have been either injured in accidents or have been denied claims, short-term disability claims, long-term disability claims. You know, we offer free consultation. We have a website with blogs, you know, certainly people could look at that. So when we offer free consultation, so once we decide to take on a case, we work on what's called a contingency basis. That means the person doesn't pay until we're able to settle their case, and we tend to move our cases very quickly because we realize that people, when they're out of money, it makes things a lot worse, obviously.
All right, Nainesh, thank you very much for your time. There's plenty more Morning Live coming up after this.